Hi, welcome to the histology trial test. This is Dr. Byson, EM. Let's prepare for this test. This is the first slide. It says, what is the slide showing? So what the slide showing is, this is the sebaceous gland. So this is the sebaceous gland. Why do you say so? Number one, they're pale staining, clustered cells with prominent nucleoli. So these are the prominent cells here. So you can say these are the cells, and the cells are pretty clustered. They're pretty clustered. And then these clustered cells are pale staining, and they've got prominent nucleus. So they've got prominent nuclei. Slide 2. What is the slide showing here? So this slide is showing a sensory ganglion. So this is a sensory ganglion. Why do you say so? One, in the ganglion, there are Nisi substances. So Nisi substances. Nisi substance is just the rough endoplasmic reticulum of sensory ganglion. The satellite cells, I'm going to show you in a minute. Satellite cells, and they are axonal fibers. So axonal nerve fibers. These are the axonal nerve fibers here. So you can see these wavy structures. These are axonal nerve fibers. This one here is a ganglion, and you have a prominent nucleus here and the nucleolus. The black substance here, these are the Nisi substances. And then the cells that are surrounding the ganglion are the satellite cells. So that is the reason. Name 3 regions in the body where we find the squamous-columnar junction. Number 1, we find the squamous-columnar junction in the gastroesophageal. So the gastroesophageal junction. When you are transitioning from the esophagus to the stomach, the epithelia is changing from the squamous epithelia to the columnar epithelia. Number 2, the vaginal cervical junction. The vaginal cervical junction. When you're transitioning from the vagina going into the cervix, it changes from squamous into columnar epithelium. Number 3, the recto-anal junction. The recto-anal junction. So when you're transitioning from the anal canal going into the rectum, the epithelia changes from squamous epithelia going into columnar epithelia. What is this slide showing? So this slide is showing the liver. This is the liver. How do you know? These are hepatocytes here. So these are cells that are found in the liver, which are hepatocytes. And these white spaces between the hepatocytes, these are capillaries, sinusoidal capillaries. What is structure labeled A? This is a central vein. there's another slide that we're going to look at that will ask us the stain that is used to show the glycogen granules that are shown in the hepatocytes here. The glycogen granules are those that are staining red in the hepatocytes, like this. We're going to look at those slides. What is showing in the slide? So this is a developing tooth. So this is a developing tooth. Where is it? It's here. So you can see that this is a developing tooth here. What type of ossification is this? This is the intramembranous type of ossification. So intramembranous ossification. What part is labeled D? D are simply the membranes where the bone is forming. So we can say this is just embryonic membranes, embryonic connective tissue. So you can say this is mesenchymal connective tissue or embryonic connective tissue. What is this slide showing? This slide is showing the sublingual gland. Sublingual gland. Most people mistaken the sublingual glands to the mammary gland. The difference between the sublingual gland and the mammary gland is that the white part in the sublingual gland, these are not lumens. These are continuous structures like this. You've seen that? And they form more like flowers. They're not lumens. You can see that. So the white part, if you connect them, you find that they are not lumens. This is not a lumen. But the white part is what we call the mucus acini. So number 2, what features made you say that? Number 1, the white parts are the mucus acini. They produce mucus. Number 2, these parts that are staining purple, those are the serous acini. This part here, that is an interlobular duct that is made up of dense irregular connective tissue. What is this slide showing here? This is the liver. Why do you say so? 1, I see this is a central vein. And then these are hepatocytes. These hepatocytes are showing glycogen granules. So the red substance in the hepatocytes there are simply glycogen granules. Glycogen granules. The spaces between the hepatocytes, this space here, these are sinusoids. Sinusoids. What stain was used? Here we've used the periodic acid. So the periodic acid skiff stain, which is denoted as PAS, to show the glycogen granules. What is shown in this slide? This is pseudostratified, ciliated columnar epithelia. Columnar epithelia. Where is this type of epithelia found? Most importantly, is found in the trachea and the rest of the respiratory system, like the bronchi, the bronchioles, and the bronchioles. All right, let's move on. What type of epithelia is this? This is transitional epithelia. So transitional epithelia. What type of cells are present in this type of epithelia? The apical cells here, these are umbrella cells. The umbrella cells prevent urine, UM cells, to enter the epithelium. And then the cells that are on the middle part here, these are polyhedral cells. They're mostly columnar cells. So polyhedral, mostly columnar cells. And then the cells on the base are just simple cuboidal cells. Simple cuboidal cells. What is showing in this slide, if you look at this carefully, this is cardiac muscle. Now the question is, why do you say so? Number one, it is branched. You can see this one here is branched. It's branched. Number two, it has these parts here that are connecting the two cells. So it has intercalated discs. Intercalated discs. Number three, it is striated. Number four, it is mononucleated. Each cell has one nucleus. What slide is showing? This slide is the fetal finger. What part is labeled E? The part that is labeled E here, you can see this is where the bone is forming. So this is the epiphyseal plate. The epiphyseal plate, aka the growth plate. In old people who stopped growing, this epiphyseal plate is going to turn into the epiphyseal line. What is the slide showing here? This is the renal cortex. Renal cortex, or you can say the kidney cortex. What are the parts labeled A, N, and Y? So N, this is the glomerulus. This is the glomerulus. A is the glomerulus rather. N is the proximal convoluted tubule. It's called the PCT. Y is the Bowman's space. All right. What condition is shown? So you can see here there's an opening here on the lumbosacral position of this baby. This is called spinal bifida. So this is called the spinal bifida. What causes this condition? It's caused by failure of caudal neuropore closure or failure of the spine to form properly. What are the types? So the types, you've got occulta, spina bifida occulta. You also have meningocele, and you have myelomeningocele. The most common one is myelomeningocele. Let's move on. What is the condition that is shown? This condition is called anencephaly. Anencephaly. What causes this? Failure of cranial neuropore closure. So failure for the neuropore to close causes anencephaly. What is this slide showing? This is dense, regular connective tissue. dense regular connective tissue. Why do I say this? Because you've got wavy collagen fibers that are parallel like this. And then you've got fibroblasts within these wavy parallel collagen fibers. Where is it found? This tissue is found in tendons, number 1. It's found in ligaments, number 2. Found in the corneal stroma. And it is also found in aponeuroses. Aponeurosis. Okay, let's move on. What is this slide showing? So this slide is showing, you can see it has glands here, and these glands have got secretions inside. So glands, secretions inside. So this is a secreting uterus. Secreting uterus. What is this slide showing? This slide is showing bone. So this is simply bone tissue. What are the parts labeled A? Parts labeled A here, you've got the Haversian system here, or the osteon. So this type of bone here is compact bone. So this is compact bone. B has got trabeculae. So this is cancerous bone. Cancerous bone, which is also known as spongy bone or trabecular bone. C is the bone marrow. C is the bone marrow. Identify the condition. This condition is known as a sacrococcygeal teratoma. Sacrococcygeal teratoma. So this condition here, this mass here, is known as the sacrococcygeal teratoma. What is the cause? Persistent primitive streak. So persistent primitive streak. Remember, the primitive streak is supposed to degenerate in the 4th week. But if it doesn't degenerate, the persistent primitive streak will form the sacrococcygeal teratoma. Name 2 things that can be found in the sacrococcygeal teratoma. Here you can find anything. You can find teeth, you can find hair, you can find bone. Because there are stem cells that are found in the sacrococcygeal teratoma, so they can differentiate into anything. What is this slide showing? So this slide is showing areolar connective tissue, or areolar or loose connective tissue. Where is this located? Loose areolar connective tissue, we can find it in the papillary dermis. So papillary dermis in the skin, you can find it in the lamina propria in the GIT. Lamina propria of GIT. What is the part labeled A? This part here, you can see this is a macrophage and it has something that is inside. So it has ingested something. So A is simply a macrophage. These other cells like this and that, these are fibroblasts. These string-like structures or fibers, these are elastic fibers. Okay. What is this slide showing? This slide is showing elastic cartilage. So this is elastic cartilage. Where is it located in the body? You can find it in the epiglottis. Epiglottis. You can find it in the pinna of the ear. And then you can find it in the eustachian tube. You can find it in the eustachian tube. What are the parts labeled B and C? So B, this is simply a chondrocyte in the lacunae. So chondrocyte in lacunae, in the space where it is found. And C is a perichondrium. This is a connective tissue that surrounds cartilage. All right. Identify the slide. The tissue. This is teased smooth muscle. Teased smooth muscle. Give one location where it is found. You can find it in the uterus. Smooth muscle is found anywhere in the blood vessels. Okay, what condition is shown in the picture? So this condition is called Sirenomelia. It is also known as caudodysgenesis. What causes this? This is insufficient mesoderm. So insufficient mesoderm in the Sacrococcygeal region. So in the caudal region of the developing fetus. So there is insufficient mesoderm in the caudal region of the developing fetus. What day of development is this? So you've seen there is the extraembryonic mesoderm that has formed, and it has also developed the chorionic cavities, and the syncytium has invaded the maternal sinusoids. This is day 11 to 12. Okay. Identify the slides. This is the ilium. This slide is the ilium just by looking at it. D are what we call crypts of Lieberkühn. Crypts of Lieberkühn. So these are simply simple tubular glands. Simple tubular glands. E is a prica seculare. It's a hue. So this is a hue. Prica seculare. Identify this slide. This slide is simply identify A and B. A is this is an artery. So this is the umbilical artery. Umbilical artery. B here, this is mucoid connective tissue or Wharton's jelly. So B is Wharton's jelly. Where can it be found? It can be found in the umbilical cord. Wharton's umbilical cord, and it will be found in the developing tooth. So it will be found in the umbilical cord and in the developing tooth. In what week of development does this occur? So this occurs in week 3. Why? Because you can see the movement of cells from the epiblast, and they are forming the trilaminar layer. So this process is called gastrulation. So this is gastrulation, which happens in week 3. Identify the slide. This is simply blood tissue smear. So this is the blood smear. You can say blood tissue smear. Name the shown parts. These are red blood cells. A is red blood cell. C, you can see this is an oval very big oval nucleus. So this is a lymphocyte. E is a neutrophil because it has 4 lobes on the nucleus. So it's a neutrophil. We know neutrophils have got 2 to 5 lobed nucleus. F is a monocyte because it has a kidney-shaped nucleus. Monocyte. B is an eosinophil because it has red granules. D is a basophil because it has blue granules. This part here, this is a platelet. Platelet. This part here is a megakaryocyte. Megakaryocyte. So these are all the components of the blood smear. Everyone is supposed to know the components of the blood smear because it is very important. It's imperative that you know this because it will definitely come in your test on Sunday. Identify the slide. This slide is the tongue. What type of muscle makes it called skeletal muscle? So the tongue is made up of skeletal muscle. What is J? This part here. J is the fungiform papillae. Fungiform papillae. And H is a filiform papillae. So know the type of papillae that is found in the tongue. It is very, very important for you to understand and to know the papillae that is found in the tongue. All right. Identify the slide. So looking at the slide, this is the vagina. So this slide is showing the vagina. Reasons why. Number 1, it has non-keratinized. So it has non-keratinized stratified squamous epithelia. Stratified squamous epithelia. And then in the submucosa, so submucosa has no glands. Submucosa has got no glands. That's why we're saying just look at this submucosa. It is clear, it has no glands. And look at this epithelia. This epithelia here is non-keratinized, stratified squamous epithelia. So you have to differentiate between the vagina and the esophagus. The difference between the esophagus and the vagina is that the esophagus has got glands in its submucosa, whilst the vagina doesn't have any glands. Identify this slide. So this slide is thick skin. Give 2 reasons. 1, it has very thick epithelium, thick epidermis. It has a thick epidermis because it has 5 layers. Presence of a lucidum makes it very thick. Number 2, submucosa has got no glands, no hair follicles. So submucosa has no hair follicles. So those can be your 2 reasons. But you concentrate mostly on the things that you can see before you come to the negatives. So that is how you answer histology questions. They're very easy. And I hope this revision helps a lot. The end. So you can register for lessons on +26 0975 497790 with Dr. Byson EM. All the best in your histology. You will do well. See you in the next video.